Dear participants, I'm delighted to welcome you all to this very important meeting on neonatal screening with a focus on familial hypercholesterolemia pediatric screening. Why is neonatal screening so important? Not only it contributes to early diagnosis of certain conditions, which allows the treatment to begin right away, but it also enables families to better plan their child's care and treatment and make informed decisions about future pregnancies. In many cases, such early interventions prevent severe disabilities from developing further and can save lives. Since the neonatal screening became a common practice in Europe 50 years ago, more than 6,000 babies each year benefit from this life-changing intervention, which significantly contributes to improved life with a screenable condition, and that's a reason to celebrate. While data clearly demonstrate the achieved success in the area of neonatal screening, we must continue promoting this practice. We must grasp opportunities offered by increased awareness of the importance of screening and by new genetic technologies which help to identify and treat children with life-threatening conditions. Although such technologies are becoming widely available in our healthcare systems, there is still plenty of work to be done to ensure that every baby benefits from it. We are here today to share our experience and, in doing so, to make sure that these opportunities are open to all children, regardless of their country of origin or societal or economic background. As such, I'm delighted to have experts from 7 member states here today, who will share their expertise and offer encouragement for further efforts in increasing both the number of newborns who undertake the screening as well as the number of conditions included in neonatal screening programs. Neonatal screening is especially important in the case of rare diseases, which are conditions affecting a small number of people compared to the general population, while often having insignificant impact on patients' lives. The European Union's added value in this field is well known, from the European reference networks to the EU research funding programs. Positive strides have been taken on health-related matters. Extrapolating best practice from member states has also played a crucial role, and it is undoubtedly clear that this extrapolation has improved the lives of rare disease patients. As a former member of the Portuguese government in the capacity of Secretary of State for Health, I'm proud of Portugal's achievement with 25 diseases included in neonatal screening, and I clearly believe that this is an example, a good example to be followed by the rest of the European countries, in line with the need to harmonise European health policies and avoid inequalities between European citizens. This is also the reason why we recognise the very positive work on neonatal screening programs developed in Slovenia, currently presiding the Council of the EU, and we applaud its ambition to lead the European Union towards increasing the uptake of neonatal screening and to enhance its harmonisation across the EU. We place great value in the input from other societies, actively advocating for the need to increase neonatal screening. I have the opportunity to speak to you on this occasion, thanks to an excellent collaboration between IPOPI, a primary immunodeficiencies patient organization, and the International Society for Neonatal Screening, who tirelessly strives to enhance the quality of neonatal screening. As most of you know, the established multi-stakeholder Screen for Rare initiative aims at exchanging knowledge and best practices on neonatal screening for rare diseases, to ensure that all babies born in the EU can have equal access to screening, which can be a life-saving tool. One of the current actions under the Screen for Rare initiative is establishing an European reference network expert platform for newborn screening, which aligns with the objectives of this event. We also appreciate the contribution of other patients' organizations, such as EURODIS. Together, these groups and individuals are seeking support from experts and policymakers to take forward key work streams leading to even greater success in the coming years, and to help ensure that all children of the EU have equitable access to these important and often life-saving services. We owe to future generations this support, and I'm looking forward to today's interactions prompted by all participants. Good work.